Welcome to Senior Moment with Nurse Linda. This is Dr. Charles Campbell, the man behind the camera, and this is brought to you on STR Network, the future of Internet radio today. And this is Nurse Linda. Hello, Nurse Linda.
Hello, Dr. Charles.
How you doing?
I'm doing good.
We're talking about Halloween W next week.
Next week, all about Halloween. We're going to be dressed up.
Our next week's show, you're going to have to watch. It'll scare your pants off.
I don't know about that, but
You'll have a good time. We're still on Breast Cancer Month.
this is our last segment. We're going to be talking about breast cancer. We're going to be trying to tie a lot of things together. The important thing to remember is 1 in 8 women will be diagnosed with breast cancer at some point in their lifetime. That's a huge amount.
How many?
1 in 8. Okay, that's a scary percentage of people. Even those that are diagnosed early or at a moderate part in the disease process, after having breast cancer surgery, up to 40% are having a recurrence of the disease. This is the importance of getting early diagnosis, early monitoring, and early treatment, and we can't emphasize that enough. So the first segment we're going to talk about today is actually breast health and how people can keep their breasts healthy and hopefully prevent this disease. One thing is, and every time we do a segment on heart disease, we did colon cancer, we did pancreatic cancer, quit smoking. Don't expose yourself to secondhand smoke.
They call those cancer sticks for a good reason.
A very good reason. It just doesn't put you at a higher risk of cancer, but it also breaks down the elastin in your skin and causes the elastin, the things that keep your skin supple and firm. And as we age, that happens, but if you smoke, that happens even quicker. Causes your boobies to droop. Okay, so there's 2 reasons not to smoke here.
Cause your boobies to droop.
To droop,
That's
yes.
a technical term.
Absolutely, yes. Okay.
Okay.
Onward. Reduce fat and cholesterol in your diet. Very important in that. We play into that with, again, heart disease and vascular disease and strokes and other cancers as well. Fat and cholesterol are linked to cancers. They don't know why. They don't quite understand the relationship, because if your cholesterol is too low, your immune system doesn't function right. You can actually be prone to cancer that way as well. Fat is good for us in moderation.
Yeah, evidently when I was growing up, there wasn't a lard my mother didn't like or cook with.
And you know what? A lot of people who grew up with that, because we were more active when women were cooking with lard and things, heavier fats like that, we were more active. We didn't watch TV as much. We worked more physical type of labor. Our bodies were healthier.
I know things were going pretty bad when we didn't have sausage, bacon, and smoked pork chops for breakfast.
There you go. But adding things like cruciferous vegetables such as broccoli and kale, if you can eat them raw, the less cooked the better, are very healthy for you and help to clean your body out and replace your body with a lot of good nutrients that you need.
Kale?
Kale, it's a leafy type of vegetable.
Like spinach?
Yeah, but it's a heavier leaf, and it's got to be cooked correctly. And honestly, I've never cooked kale. I've had it, but I've never cooked it, so I can't give anyone advice on it. Don't call me for recipes.
I like broccoli.
Give it to you. Yeah.
I like cauliflower.
Broccoli, cauliflower, all of those kinds of things. The dark green vegetables are all very healthy for you. Alcohol consumption. We're not saying that alcohol consumption is bad for you. It's actually been shown to be beneficial when it's done 1 or 2 drinks per day. Not, well, I didn't drink it all this week, so now it's Friday, I can have 6. No, doesn't count. No more than 2 a day. Very important. Green tea versus coffee. Caffeine can put you at higher risk for developing cysts, especially if cysts tend to run in your family. Some women are very sensitive to that. And any caffeine whatsoever will cause cyst formation. So
you're saying cysts are genetic?
They can be, yes. People with cystic breast, it tends to run in the family. Just like somebody who has a tendency to form a lot of moles on their skin, it tends to run in families. This is the same kind of thing. So again, it's just watching, talking with your doctor, getting the information you need to make a decision. Decrease your caffeine, increase your antioxidant intake. And you do that through green tea and through those wonderful dark green vegetables.
What about black tea?
Black tea is good as well, but black tea tends to have caffeine in it. You have to look for decaffeinated tea. Even the green tea, I drink green tea, and it is decaffeinated green tea.
Okay.
So keep an eye on that.
Does it taste different?
No, well, to me it doesn't. No, I find caffeine tea actually tends to be a little bit more bitter when it has caffeine in it.
That's why I put sugar in tea.
No sugar, no sugar, no sugar. Okay. Exercise. Keep a healthy weight. It increases your immune function, your ability to decrease your risk for cancer. Cancer can be a function of your immune system, a dysfunction of your immune system. Our bodies are forming cancer cells every single minute, but our immune system is able to beat them back. We keep healthy with our weight, our diet, exercise, everything like that. We tend to be able to beat back those cancer cells. Know your family history. Having a first-degree relative with breast cancer increases your lifetime risk by double.
First degree.
First-degree relative, a mother or a sister.
Oh, okay.
Okay, puts you at a lifetime risk of doubling your risk of getting cancer. If you have, what did I read, 2 first-degree relatives, your lifetime risk goes up by 5 by having 2 first-degree relatives. Know your history. The other thing is sleep, and this is true of any chronic disease. Our bodies need sleep to regroup, to gather ourselves together, allow everything to rest and reset, almost like turning off a computer after you've updated it. You've got to shut it all down to bring it back up the right way. And that's what sleep does for our bodies, and it's very important. And a lot of people don't realize that. Along with what we've talked in other shows about exams, self-breast exam, a physician exam, getting your mammograms, all of those kinds of things, those follow-ups are needed to keep our breasts healthy.
Got to keep them boobies in good shape.
Save the tatas, absolutely.
What's our second segment?
We're going to talk about the complications of breast cancer treatment.
Okay, and our third
Is going to be on complementary treatments for breast cancer and how they can be helpful.
Well, you want to check on the list and watch those because you really need to. Thanks for tuning in this segment. We'll be right back.